Welcome to Therapy Facts with Dr. Jenn. The third point about how to start therapy is regarding the format of therapy. So, traditionally, the format of therapy has been face to face. Most therapists have provided their service in a face to face format, typically like you see on television, where you have a therapist in the room, typically in a chair, and you have a client in the room, typically on a couch or a love seat or a chair themselves. All right, so that's stereotypical and not the only way therapy can be provided, but it has been very traditionally done that way. Since the advent of COVID, however, the format of therapy has leaned very heavily towards virtual therapy, where people are being seen through video chat or telephone and even email and text messaging as regards the online only services. So these services or these formats were available before COVID, but before COVID, the traditional face to face was mostly regarded as appropriate. Then the telehealth movement started maybe about 5 years before COVID, and then it really took off with COVID. So, what happens with the telehealth, doing it online or email or texting, it allows for the opportunity for a greater spans of therapists or greater choice of therapists that can be chosen because you are not limited to therapists to whom you have some geographical access. And so, in the case where a therapist is licensed for the whole state, then they can see people who live in the whole state, regardless of where they live and regardless of how far away they may be from a face to face office. And so that has really opened up the opportunities for people in less populated areas and even therapists in less populated areas to be brought together for therapy. And so that has really helped the availability of therapy at a very important time where the demand for therapy has increased. The reason that face to face was considered so important and is an important format is because there are a lot of ways that people communicate other than with their words. Body language, energy, facial expressions, posture, all kinds of elements are included in the communication process that will be picked up on in a face to face session that might not be picked up on in a virtual session. However, video chat goes a long way with helping the therapist and even the client pick up on those nonverbal communication processes. Now, I actually prefer phone therapy because I believe that it gives people an opportunity to gain a certain level of comfort that they might not have with the pressure of sitting in a room or sitting on a camera communicating with someone that they don't know very well. And so I have seen, even before COVID, where telephone therapy allows for someone's details to be brought forth more candidly, much more quickly than when I have met people face to face. I have no experience with the online services where you're just texting or emailing back and forth. I can imagine that the emailing, especially, and even texting, perhaps, depending upon how extensive it is, can really be a great way for participants or clients to share their details, like I said, which are the currency, the details of the currency for the therapeutic process. So I can imagine that those formats are even more comfortable for people who like those formats for and will facilitate the therapeutic process in a way that a face-to-face session may not. We do know from research that face-to-face sessions can require a pretty lengthy amount of time for people to be able to feel comfortable enough to share their important details. And so, while it is we'll say the hallmark or the standard for therapy, the new therapy formats have allowed for a greater choice and a greater opportunity and access to therapy, and may allow for more comfort with sharing therapy details of one's experiences for the therapeutic process. So be open and mindful that going to therapy may not require you to go anywhere, but you can decide and have choice about who you want to see and how you want to see them.